So I'm very happy to welcome Mandla. Before I introduce him, let me just say a few things. I think everybody is already muted, but I appreciate if you do mute yourself. We do want to have interaction, so please use the chat function if you have any questions, and I'm sure there will be questions along the way, and please feel free to use that. We're going to have a conversation, Mandla and myself, but also include you. So I imagine for the first 10, 15 minutes or so, he and I will speak about and try to get all of you on the same page in terms of the kinds of work that he's been doing and some of the complexities that he faces in the field under COVID and even prior to COVID. And then we'll hopefully really have time for engagement and for people to speak to Mandla directly. I'm not going to waste any time reading his impressive bio. Just to say that you can find that on the same link that brought you to the meeting today. But one thing that will resonate, I think, is the long history that Mandla has, not only working in communities in South Africa, but also as a leader of the Treatment Action Campaign, which many people will know of as one of the most important organizations that whose activism got treatment for HIV to the people who really needed it. And Mandla played a really critical part in that campaign, and indeed, if you see his bio, in multiple other campaigns as well. So I'm very happy to welcome Mandla. And Mandla, why don't you start, if you don't mind, just by introducing yourself and saying a little bit about the work that you do and what led you to the work that you're doing now.
Thank you very much, Comrade Mark. You've been very kind to me. My name is Mandla Majola. I'm born, bred, battered in Gugulethu, Cape Town, South Africa. I'm an activist, and I've spent better part of my youthful age getting involved in community activism. Currently, I've been working for UCT, Division for Social and Behavioral Science. Unfortunately, my contract came to an end last December, but thank you, comrade. But busy working in different communities now. I work in Gugulethu, I work in Khayelitsha, trying to organize and mobilize those communities against COVID. I am trying to ensure that our communities are informed and aware about COVID-19. And it's all part of trying to save lives and ensuring that our communities are prepared and ready to deal with the challenge. I've been blessed enough to have worked with Treatment Action Campaign. I joined Treatment Action Campaign in year 2000. Just a bit of a background. My aunt got very sick in 1999. And she was admitted at Josta Hospital. And unfortunately, she passed on early February 1999. And we buried her on the 14th of February 1999. And I was tasked by the family to look into her personal stuff and communicate her death to different stores and try to close down her accounts. And unfortunately, I came across a letter that was telling her that she was HIV positive. And the sad part, she never shared that with us. We were not part of that journey with her. We were not there to support her. And at that time, I was very shocked, depressed. It was very painful for me because I was very close to her. And my family, we made it very clear to me and to my siblings that the line that we're going to communicate regarding my aunt's death is that she was bewitched. Nobody's going to mention the issue of HIV and AIDS. I think her death, in a way, provoked some bit of activism within me. I wanted to get involved. I wanted to learn about HIV, and that is why I ended up joining Treatment Action Campaign in 2000. It was because of my personal grief and my curiosity, my anger, my frustration, my fears. And when I joined Treatment Action Campaign, that's where I learned about treatment to treat HIV. And at that time, there was no access to treatment. So I joined the struggle with the aim of educating my community, with the aim of creating awareness in my community, mobilizing my community, organizing my community, and to put pressure. The whole idea was to put pressure on the pharmaceutical companies to reduce the prices of treatment to treat HIV, so that poor people, poor Black people at that time, should have access to treatment, regardless of their economic status. That is my background when it comes to activism. Yeah.
Thanks, Mandla. Thank you so much for talking just in such personal terms. It's a reminder, as we remember statistics, whether it's about COVID or HIV, that there are people behind each and every one of those stories, and in many ways the world is better off for that event because it mobilized people like you who made such a difference in their communities. Mandla, let's talk a little bit about COVID, because you mentioned that, and we'll talk about it as well. But you talked about helping your community, and I wonder, can you talk really specifically about what kinds of activities that involves? What kinds of things are you doing? What are the things that seem to be working, or what are the difficulties that you're facing? Can you describe sort of how you translate that helping of communities, in relation to COVID? What does that actually look like on the ground?
Just to give a bit of a context, we have 56 million people in South Africa. 8 million has been tested for COVID, and 1.4 million tested positive for COVID. 1.2 have recovered fully from COVID. We have lost about 41,000 lives to COVID. In my community, Gugulethu, I'll talk briefly about Gugulethu. Gugulethu is a community of about 100,000 residents. That's where we've been working to organize and mobilize communities around COVID. Last year, March, I got a call from Dr. Eric Gomez, the guy who started Medicine Sans Frontiers in South Africa. He's based in Khayelitsha. So Dr. Eric phoned me and said he wants to have a meeting with me. I went to meet with him. He had his own concerns that MSF doesn't have the foot soldiers to deal with COVID on the ground. He requested that I should work closely with them and bring movement for change and social justice. That is the organization that we formed in 2016. I should bring the organization to be part of the whole organizing and mobilizing initiative, both in Khayelitsha and in Gugulethu. I agreed because I felt that there is a need really to work closely with MSF to address COVID in our communities. So I immediately organized my cadres or comrades. We decided to meet and we took a resolution that we need to get involved in COVID. As much as it's a risk to our health, to our lives, we have committed ourselves to serving, sacrificing, suffering for our communities. So this is the moment that we need to work and deal with COVID in our communities. So we met with the MSF and we made it very clear to MSF that we are not informed about COVID. So they need to train us first. MSF did the training. They trained us around COVID and gave us the necessary information that we can use in our communities to organize and mobilize our community. To speak about our work at community level, one of the responsibilities is to go door to door to different communities and talk about COVID. Obviously, one needs to wear protective gears to ensure that you do not pick up COVID or you do not spread it. So our cadres are very much informed. So we went to communities, we went to talk door to door. We distributed pamphlets. Besides informing the community, I'm also involved in an initiative where we are developing masks. So we took responsibility also of distributing masks to different communities. We've been able to distribute more than 30,000 masks, both to Khayelitsha and to Khayelitsha, because we realized that many people are unable to buy masks. Masks are very expensive, and they are expected to wear masks at all times. We also assisted some of the communities with sanitizers. There were many challenges. One of the challenges that the community has been complaining about is no access to food shortage, because people are locked down at home, they are not working. Majority of residents are working in the informal employment sector. They get food by going to work today, and they get their day's wage and they're able to buy food. So if they are locked down, restricted to move, they are struggling to access food. We took again initiative of mobilizing our friends, different places, Virginia University, Brown's University, different comrades at UCT. We mobilized, we got support from the friends of the Movement for Change and Social Justice, Akasha Global. We were able to get food vouchers for different communities where there are needy families, really struggling families. So we were able to give them food vouchers. At night, we will go around with loud hailers doing education in different communities, because we knew that at that time, at least it's quiet, people at home. MSF has given us a permit that we can show to the police that we are granted a permit to move around and educate community. So we targeted some of the communities around 8 o'clock at night with loud hailers, educating community, trying to deal with fear, trying to deal with stigma, giving support to those who are already infected. There were many challenges, as I indicated, that one of the challenges is in the informal settlements where people do not have access to water. It's difficult for people to wash hands. In the informal settlements where people are sharing toilets, we've got informal settlements in Cape Town where one chemical toilet is expected to service 10 different families. It's a challenge for those families to use toilet, sanitation, to have access to water, because there is no access to water. Some of the families where a person has tested positive for COVID, and they are using or have access only to one room shack, 9 family members, how do you then begin to say you need to isolate yourself? Where are you going to isolate yourself if you've got a very small space where you are sharing with a family? So we had many challenges when it comes to COVID. Again, during lockdown, some of the poor communities who are only able to make use of public health system, they were struggling to access their chronic medications because some of the clinics were closed. People are struggling to access treatment. Sometimes people are unable to get treatment simply because of the numbers at the clinic that they are able to allow to come in. People will wait outside for many hours, ending up going back home without treatment. So it has been a struggle for many people when it comes to COVID. Then the issue of death in our communities. It's one biggest challenge that we have experienced. Again, trying to educate people to understand that we should not congregate in big numbers. We should not converge, organize the memorial services in big numbers, because that's where the COVID spreads quickly. Some of the families have been struggling to mourn, give their loved ones a good sending when they've passed on. And in some of the families who have lost family members, it has been a struggle because they can't see them, they can't visit them in the hospital, there is no closure. So it has been a nightmare for many communities, but we have to adjust and adapt. So the Movement for Change and Social Justice, the organization that I'm part of, has a responsibility of organizing and mobilizing the community. We have a responsibility of educating communities. We've been working closely with Department of Health in the province, getting pamphlets from them, getting posters from them, and ensuring that we are able to disseminate the information across communities, with the aim of ensuring that communities are informed, communities understand the importance of using a mask, the importance of washing hands, the importance of sanitizing. But as I indicated, there are barriers when it comes to poor communities. Now, when you compare that, I always want to compare that. You compare poor Black communities, places like Khayelitsha, Khayelitsha, with affluent places like Sea Point in Cape Town, like Camps Bay, like Rondebosch, where white people are residing, are staying. It's a different world, because in those affluent communities, people are able to work at home. People are skillful enough, people have got tools, people are working jobs where you can work at home. People, when they've tested positive for corona, they are able to isolate themselves within their own houses because they've got spare rooms. People have got enough food that can last them for the next 6 months. People have got enough money that can sustain them. It's a different world. Come to Cape Town, we've got 2 countries or 2 worlds in one city. And COVID has once again exposed the inequalities in our societies. Yeah.
Thanks, Mandla. Once again, you just painted such a vivid picture of how people are dealing with these complicated issues. Mandla, I'm going to ask one more question, but also remind people, please, if you have questions, feel free to start putting them in the chat. And I might even call on you to ask them in person, because there are actually many people on the call on the Zoom who've had the opportunity to meet Mandla and to work with him and some of our projects at the University of Cape Town. So you'll see some familiar faces there as well, Mandla. Mandla, you're wearing a shirt there, and you mentioned MCSJ, the Movement for Change and Social Justice. That's an organization that you and some local colleagues started over the course of the last few years. And I had the opportunity to see that organization grow up a little bit in the sense that, it didn't really exist, and you started talking about it and you developed it, and now it's a very important group. So, and you've mentioned it a few times in your work, and how MCSJ was instrumental in some of the COVID work that you've been doing. Talk a little bit about the history of MCSJ and what kind of campaigns you're involved in. What is the purpose of the organization, and what does it actually do on the ground?
2016, in April, I was very fortunate to get an employment at UCT, Division for Social Behavioral Science. I was very fortunate to work with Professor Chris Colvin. I call him Comrade Chris Colvin, and Comrade Mark, under the men's project called I-Alarm, focusing on men, HIV, masculinity, and the clinics. Why some men test for HIV and treat, why some men do not test and treat. What are the barriers? What can be done to address that? Now, I need to say this, I'm an activist, not an academic. My approach has always been about community. Let me say this again. Some of the research projects to some of the students, lecturers, research institution, it's a 9 to 5 day job. For some of us, it's our lifetime. It's what we live. It's not 9 to 5. It's where I grew up. It's who I am. I can't run away from it. So when I joined UCT, I was tasked to take a responsibility of connecting the I-Alarm project that focuses on men, HIV, masculinity, and the clinics with the community, and to assist students to get research participants. So I took that responsibility. I worked there with different comrades. While I was working at Khayelitsha Day Hospital, I was approached by a number of patients who were not aware that I was no longer involved in treatment action campaign, who thought that I was there because of treatment action campaign. So they approached me and they were complaining about the quality of service that they were getting. To give an example, there were patients there who were going to the facility to get their treatment on their appointment days. But unfortunately, they will be deferred to another day, and they will go there for the next 4 to 5 days without getting their chronic medication. So there were many complaints. I took those complaints seriously because that's my community, even if it was not my community, but because I'm an activist, that I had to listen to that and find a solution. So I communicated that to my department, that there is a complaint, there's this problem. There seems to be challenges with the quality of service. And cut the story short, we had a long conversation with Comrade Chris and Comrade Allison. We ended up agreeing that I need to find a solution to the problem. Though it was indicated to me that UCT is a research and teaching institution. Our role is to research and to teach, not to fix the problem of the community. Once again, I'm an activist. I'm not an academic. So when I see those problems, I want to work with the community to solve them. So I began working with the different organizations. We approached the facility manager regarding the quality of service. And we said we have been approached by many patients complaining that they have been deferred to another day when they're coming to pick up their antiretroviral drugs or treatment for diabetes or high blood pressure. So the facility manager dismissed and said, I do not have evidence, blah, 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 blah. So I went to the community, I collected evidence. Fortunately for us, I was approached by a guy whose name is Sitembele Mkiva Blackstein. He is 56 years old. He is epileptic. He became epileptic at work and he was allowed to go home. Unfortunately, at home, he had no medication. So he communicated with his boss that he needs to go the following day to get his medication. So when he went to the clinic to get his medication, he was deferred to another day. And he communicated to the boss, and the boss said, no, I've only allowed you to go on a particular day. If you go again, I'm not going to give you money for that day. So he decided to go because he was worried that he's going to die. He went there for 3 days without getting his treatment. So on the 4th day, he got his treatment. So we took his story, we wrote it down as a testimonial. It's one of the tools that I've learned from treatment action campaign and social justice collision. We took his testimonial and many other testimonial as a proof or as an evidence that people are denied a service. People are being deferred to other day, and it's putting them at risk of defaulting, and it might lead to unnecessary death. To cut the story short, once again, it was very difficult in our meeting. So I had to, in a way, indicate to them, that is the facility authority, that I was going to organize a big march. And they thought I was still at tech or had a strong connection with tech. At that time, I did not, but it was just a trick. So in 14 days, 2 weeks time, they hired the pharmacy manager with an assistant, and they were able to address the backlog. We addressed that as treatment action campaign and many other problems. So we are working with the community to look at the problems and to try to find solution with the community. Now, one of the things that I always advocate is that we need to do community organizing. We need to organize our community, and we need to do door to door, go to each and every house, speak to people, and try to organize and mobilize them to be part of our activity. We are focusing as the Movement for Change and Social Justice in 2 campaigns. One, public healthcare system. We are unhappy with the quality of service that our people are getting from the public healthcare system. There is a big divide. There is a huge gap regarding quality of service between the private health system and the public health system. Majority of the South Africans, probably 87%, is using public healthcare system. And the quality of the public healthcare system is very bad. And majority of the people who are using public healthcare system are Black people. Private healthcare system, it's doing very well. It's providing very good service. And majority who are making use of the private healthcare system are white people, rich people, people who are able to afford. Now, that's one of our campaign. Second campaign that we are really passionate about is gender-based violence campaign. There's been many attacks against women and children. Many people have been raped, many people have been raped and killed, and the movement has many women who are in leadership position. It's our responsibility to organize and mobilize community against gender-based violence. Now, we have done those campaigns to organize our community, to educate our community, to put pressure in our Department of Health, put pressure in our government to deliver when it comes to the national health insurance, where people are able to access better public healthcare system. Also, we've been putting pressure in our government to find ways of addressing gender-based violence in our community. There's been a lip service when it comes to gender-based violence. Government is not doing enough to address that. Now, we have also worked closely with the University of Cape Town, particularly our department, Division for Social and Behavioral Science. I'm also very passionate with a research institution or a research project that gives respect to communities. We have been able, with Comrade Chris, Comrade Mark, Comrade David Edmonds, and many other comrades, Alison, to do research in Khayelitsha around men, HIV, masculinity in clinics. Once we've been able to come up with the recommendation, we've been able to give reports back to the community. From 2018, we have organized research in Daba between UCT and Khayelitsha community, where our community can come and engage with the research report and ask questions and challenge on issues that they are not comfortable with, and give their own recommendations or advice on issues or ways of addressing the problems that we're having in our community. Secondly, we've been able through our research project in our department to acknowledge Gugulethu, not only as a community where we are extracting information, but as a community that participates in a co-creation of knowledge. We are participating as a Gugulethu community in assisting University of Cape Town coming up with recommendation in their research reports. I have an issue, I've said it many times, with research students who come to poor communities to do research and leave without giving research reports, without acknowledging our communities, without working at an equal level with communities. Research students or research supervisors that go in and extract information without realizing that they have to work hand in hand with the community and give back to the community. Research institutions that do not want to be part of resolving some of the problems in those communities. Research institutions that they come in, write their reports, and some of the students want to please their supervisors and they move on. I have a problem with that. Our responsibility, or the responsibility of universities, must be always to help communities, make communities better through information, through knowledge, through finding ways of working with those communities in addressing those problems. You can't come up with a recommendation and you said, we have done our part. We are not going to get involved. For me, that's not fair. That's not right. That's not correct. Research institutions have been getting lots of funds. Millions have been invested in research institutions. But research institutions do not want to invest in those poor communities. They want to come, get information, move on, and get all those, inverted commas, colors or acknowledgement that they've done very well in terms of they become armchair activists and they speak from a distance, social distancing. What we see in Corona now, they've been doing it for some time. They want to resolve problems from a distance and say, we have resolved. I've been working with that community. They've not been working with that community. They go around lying because they get information through students and they do not go back and work with that community to address those problems. That become problems of somebody else. I've seen it with AIDS when I joined Tech in 2000, where people take photos without getting permission from poor, illiterate community members. And one of our responsibilities as the movement for change and social justice is to create that equal level field between the two institutions, the poor community and the research institution, and we work together to address the problems. Yeah.
Thanks, Mandla. You've given us 101 things to think about there, for sure. See, a couple of very interesting questions have come up, some of which you already touched on, but let me tell you a few of them and then you can decide how you want to answer them. One is about COVID, a sort of reference to the fact that in the US, there are significant number of people who are deniers of COVID, who are against wearing masks and who are probably not going to want to get the vaccine. To what extent have you been encountering that in South African setting? And if so, if at all, what can you do to address those kinds of issues? And then a more general question, I guess, some of which you've already answered, but again, just a very interesting one. What does your typical day look like as an activist?
Let me first start with the first question. I'm sure you're aware that everybody's aware that we have a history of a former president, Thabo Mbeki, who was in denial of HIV and AIDS. I've been at the center of that controversy where I've been working in communities, trying to organize and mobilize communities around HIV and antiretroviral drugs. And you have a president who's saying there is no link between HIV and AIDS. that creates a big problem for activists, for healthcare workers, for frontline workers, for everybody who's trying to deal with the issue. Fortunately and just last point with that, you can only be able to measure the impact of that denialism with the numbers of people that have died from HIV and AIDS. Because I know of many people who said the president says there is no HIV. The president says, or the late Minister of Health says antiretroviral drugs are toxic. So I'm not going to take antiretroviral drugs. I'm going to eat better. I'm going to have a good food or better diet. Many people have died from that confusion, and it was unnecessary, and no one has owned up to that, including the ANC and the former president. That was genocide. Fortunately for us, currently we have a president who has taken a lead when it comes to the issue of COVID-19, and the same with the Minister of Health. They've been at the forefront. They've taken cue from the scientific evidence when it comes to COVID, and whatever communication that they've been sending out has been followed by the community religiously, because the president has said this, and we think that it's right, it's correct. He's wearing a mask, he's advocating about social distancing, sanitizing, and all that. Unfortunately for America, you've got your own, or you had your own Zuma moment, where you had a president who was saying something else or doing something else when the science is saying something else. President doesn't want to wear a mask, and that can be seen to be correct by those who follow him blindly. And you are able to measure it once again with the numbers of people who get infected and who are going to die, unfortunately. We had problems with people in our communities who have been fearing for a vaccine, that what if a vaccine does this, makes me not to get children, you know, all these talks that are inaccurate, misinformation that is aimed at creating confusion. Once again, Department of Health with civil society, we have been trying to deal with those misinformation in our communities, urging people that when the vaccine comes, please use the vaccine or take advantage of getting the vaccine. I've been in a different spaces where I've been telling people that I do not have polio today, partly because of the vaccine that I got when I was young. So there's nothing wrong with the vaccine. So we had those confusion in our communities, but it's our responsibility to mobilize and organize and spread the correct information. Fake news is there, and it's going to be there for some time. Activists have a responsibility of dealing with that. My day's work, how my day look like. In the morning, I go for a run, 1 hour, 30 minutes to 2 hours. I struggle with depression, and I speak openly about that. I've been speaking openly about depression for some time. I became depressed in 2000, and when I joined tech, I've been at the forefront. I've sat in many beds of people who are very sick and who have died of AIDS. At some point in 2004, I went to see a psychologist who advised me to name down names of people that I've met who have died from HIV and AIDS. I stopped around 200 when I was writing down the names that I remember. I've never mourned those people, partly because at that time in tech, there was a huge concern about saving lives. So it was always about activity. And our government was giving us a hard time. So I was busy with many events. If you have seen many march in Cape Town, I was part of those people who organized those march. So I'm struggling with depression. In the morning I run. I've been spending most of my time in the informal settlements. I've been invited in different informal settlements to talk to different community leaders, give support, give guidance, sometimes to listen to what people are saying. I'm very passionate about educating communities, but I always say that one has to earn the respect of the community. It's very important. You need to win the respect of the communities. Once you have won the respect of the communities, then you'll be able to get the people behind you. People will support your campaign or the campaign of the organization. People will be there at all times. Yeah.
Thanks, Mandla. Once again, you've given us 100 things to think about there. From far away, you've described some of our problems, both in your country and in our country, in very vivid and personal terms. Really appreciate that. And for those of you who don't know, Mandla, on top of all of that, is an ultra marathon runner who's running some of the most difficult and grueling road races that exist, and survive that too. Mandla, looking forward, I wonder, when you think about yourself, maybe years from now, when we're reflecting back on COVID, let's hope there is such a time. What do you think are the lessons for community organizing for activists like yourself that will have been gained from the COVID pandemic?
One of the lessons, I think, is to find ways of organizing and mobilizing communities without probably doing door-to-door. We have to find ways now of using more technology. We have seen in our organization the importance of using WhatsApp, and we have used WhatsApp more in organizing our communities. And many people have been getting information, especially our members, through using technology. But also, I'm a firm believer that as long as communities are organized, communities stand together, we'll be able to address the inequalities, economic inequalities that we are facing in our country. In 1994, we got political freedom, not economic freedom. COVID has came once again to display the inequalities, economically speaking, in our country. The job that is still there to be done by the current activists. We cannot carry on blaming Mandela generation. They did what they were supposed to do. Currently, we are struggling in South Africa with many things, particularly economically. Many people are unemployed. Many Black families in poor communities do not have access to many resources. Our schools are not functioning well. Our clinics are not well resourced. We do not have enough staff. You go to Home Affairs, people are waiting in queues. Now, these are the challenges that people are wrestling with. We are struggling to send kids to universities because education has become expensive for many families. Yet our country is seen as the richest country in Africa. But the majority of indigenous people are not accessing the resources. Few families, few individuals are the ones who are enjoying everything in our country. Now, one of our responsibility when it comes to COVID, we need to address the economic inequalities in our country. I was speaking again with a few leaders today that the sad part is that in affluent areas, schools are carrying on because kids are able to do online learning. Parents who've got internet, who've got laptops or PC in their own homes, their kids are able to learn and they are moving on. Life goes on for them. If you go to Township, people have no access to internet. People do not have computers. Our government does not have the political will to address the economic inequalities in our country. The ANC has sold out, and it is us, the communities, the poor people, we have to organize and mobilize ourselves and put pressure to the government of the day to deliver the real freedom to poor communities. People are really frustrated on the ground. People do not have food. There is lack of access to food. There is food shortage in many communities. People do not have employment. People are not secured. I am unemployed. I've got masters. I've registered once again at UCT to do masters once again in public health. I want to up my game. I am unemployed. I've been really stressing about my debts, how I'm going to pay them. If I am unemployed in the last couple of weeks, how much more people who've been unemployed for many, many years? How much more with families where both partners are unemployed? Fortunately for me, Fuseka is employed. She's able to take care of some of the problems. I'm unemployed and I'm struggling with that. And it's the struggle that our communities is wrestling with that creates a big problem in some of the communities. So we have to find a way of mobilizing and organizing our community to become a one voice. There are two powers that we get. That's what I've learned. One, through money, financial resources. The second power that you get is through organizing and mobilizing communities to speak with one voice. We don't have money, we don't have resources, but we've got people's power. We've got people on our side that we can organize and mobilize. People can speak with one voice, and we vent out our anger in a more disciplined, peaceful way, articulating our needs and our challenges as poor Black communities. So those are some of the lessons that I've learned when it comes to COVID, that our communities are not the same. And unfortunately for some of people who are in a better places, they do not care about those who are in poor communities. People are well-resourced, are fine, and they said the Black government must take care of the Black people. We as inverted commas, white people, we are going to carry on with our lives. And some of us who are activists, we need to find a way of bridging the gap before it becomes too late. We can't have another countries in Africa or follow an example of other countries in Africa where it looked great, but it turned out to be a mess. We can't allow a messy situation. We need to find ways of encouraging, putting pressure.
Did we just lose Mandla there? I think we did. Well, I was going to say this would be a great place to finish, but I hate to finish in the middle of a sentence from Mandla. However, I do have my eye on the clock, and Mandla, I hope that you can hear us. This has been a most stimulating and really, really interesting hour. I want to thank you on behalf of Brown University, International Health Institute, the Office of Diversity and Inclusion, and most of all, thank you for your time that you spent with us today. Everybody be well, and as we say in the modern COVID age, stay negative.